Good afternoon, ladies and gentlemen. Namaste. And for my Muslim brothers, Salamun Alaikum. There is an ayah of Quran which we strongly believe, Rabbi shrah li sadri wa yassir li amri wahlul uqdatan lisani yafqahu qawli. And there is one another ayah which says, La taqnatu min rahmatillah. This session has been very, very emotional. And I want to draw your attention and crack some jokes before I start, because there is always hope. The ayah which I recited from the Quran, from the Holy Quran, says, never lose hope in God. You may think that you may not conceive, but believe me, this international conference on medical tourism has thrown so much light that everybody can have a child. There was a session in which was asked, what is the definition of a gynecologist? A very smart gentleman stood up and said, a gynecologist is a person who finds difficulties in the part where others enjoy. Ladies and gentlemen, let me have the first slide, please. These are not my objectives. Objectives I will tell you at the last. But really, India has so much advance in assisted reproduction. You can see that I, as a gentleman, sitting alone with two ladies, and you can bear with me that I can treat ladies better than anybody. You will have obstetric fistulas, but our country, Kenya, is very much advanced, and we can handle that one. But there are so many other difficult cases of fistulas, like the fourth perineal tear or the rectal and where the vesicovaginal fistula is also involved. And after further repair also, the patient does not heal. So basically we need a lot of expertise, and many times we need a surgeon from India and a surgeon from Kenya who can do it together. You may need an abdominal approach, also a vaginal approach. My colleague has already addressed about surrogacy and adoption. India has now not allowed after 2015 November about surrogacy and adoption. But what I suggest, their expertise can help us to set up a center in Kenya itself, and we can use our own population to see that we can also light some life in the houses where there are no children. Fetology is a very, very important thing. We have twin-to-twin transformation syndrome, and with fetoscopy, we can do laser ablation and help the mother to get her baby. Gynecology, oncology is a very, very advanced field in India, and we are also advancing, but some of the cancers, like ovarian cancers, and the last stages of ovarian cancer, we cannot handle it. I'll go through some of the slides, and you will believe that India has the expertise, but we, underdeveloped countries, we are still doing our level best to have the expertise from India and other parts of the world. And telemedicine, I think it will be covered in the next session, but I will throw some light on telemedicine. Next slide, please. Intrauterine insemination. Intrauterine insemination is a relatively simple fertility treatment. It may be done with or without fertility drugs. The procedure itself involves transferring a specially washed semen directly into the uterus via thin catheter. It is from the same, that is from the same husband, and it is transferred into the same female. Next slide, please. This is just a technique to show. I don't want to elaborate on how it is done, because just now we are just discussing what we can gain from India and at the same time set up centers in Kenya. We don't want to transfer our patients to India because there are other problems. Visa, everything has been discussed before, money problems, staying problem, though India is very welcoming. And I'll never forget, India gave me the best education. I've been educated at All India Institute of Medical Sciences, and I'm totally in love with India. That's why I married a woman from Hyderabad. Next slide. These are the indications, and I don't want to waste time because my colleague has already explained. Next slide, please. And this is the procedure, how it is done in vitro fertilization process. Next slide, please. Surrogacy, she has covered it very well, but unfortunately, India has banned surrogacy from other countries. But as I told you that we can use their expertise. Next slide, please. Phytology, it's a very, very important thing, and India is very much advanced in that one. I personally don't think, because I'm a very old gynecologist, I look young, and I'll tell you that when my second wife was delivering, the nurse comes outside and tells me, Dr. Mauladina, you have become a grandfather. I said, I'm still a father. Next slide, please. This is the procedure, how it is done, and they have a better expertise. But our qualifications in Kenya is very good, but we don't have the machinery. And I'm very grateful to India because they do give us a lot of help in medical instruments. And I wish in this organization, if they can put a word to the Indian government or whatever organization, and we can have this instrumentation in Kenya. Next one, please. These are the cancers, and most of the cancers we deal them with very great efficiency. But ovarian cancer, especially the ladies, do come in a very advanced stage. And India has got a very good expertise in radiotherapy and chemotherapy. And we can do our, we can share the expertise on telemedicine, and we can benefit the patient. Next slide, please. This is all about ovarian cancer. I don't want to go to the history of ovarian cancer because basically our session is only implying what we can do with India and Kenya. Next slide, please. These are the stages of cancer, and I'm sure there are very few gynecologists and they know their subject quite well. Next slide, please. These are the obstetric fistula, and it is very unfortunate that in spite of well-developed countries, including India, that when the care is not taken at the last stage when the woman is delivering, we result in all these fistulas. And we can avoid them by taking great care, as Dr. Khadija has already emphasized that in Mombasa also we have, but now the government of Kenya is taking very strict actions when these things are done. Next slide, please. This is telemedicine, and I'm sure it will be covered, but my job today is that what relation we can develop between India and Kenya, and of course other countries. People will think that all the audience are Kenyans. I'm sorry about it. We are all privileged to be here, and we want to build our relations and have centers of excellence, taking expertise from India rather than sending our patients over there. We'll take their expertise and send them to Kenya or other countries in different part of the world. Next slide, please. Now, these are the things which I wanted to emphasize. Package treatment. We should be as friendly, pocket friendly to the patients, because many times on the phone, with all due respect to doctors in India, they say different price, and then when the patient comes, they say, no, this thing happened, this thing happened. There should be some ethics in our profession that we should not overcharge our patient. Though I'm aging, that's why I'm saying like that, but even when I was young, I used to be very, very friendly to my patients, pocket friendly. Follow-up is very necessary, because once the patients are operated or have been given treatment in India, there should be proper follow-up in our own countries, and we should tally with the people who have operated here. And this one, there are some courses. I was just in America and Canada, And I visited some of the universities, and they have a special course in doctorate in medical tourism in California, Alberta, and Newfoundland in Canada. I think medical tourism itself is a course which every doctor or a physician should take who are interested. So we will know the ethics, we will know how to refer the patient, which specialty to refer, because sometimes, like I'm a gynecologist, I cannot do some of the cases in gynecology, but then also just to be happy with the money which I will receive, I'll say, no, I'll do. And then I'll invite another doctor to do. That is also fine. But I think we should be very transparent with our patients. I think I have completed everything, and I would like to, at that end, I would like to invite you all for the symposium on IUI and IVF in Nairobi at the Kenya, at the Nairobi Hospital on 23rd and 24th of April, 2018. And that is, you can go on the website and you'll get all the details. I am the chairman of the symposium. I am specially come here to invite you all, and you are cordially invited to Kenya, and we shall receive you. One more. There is one more? Oh, yeah. And there is one more slide. Yeah. Now this one to end. Professor of ophthalmology was retiring, so they thought that what should we give to him? So they presented with a model of an eye. So he said, let me thank you all and thank God that I'm an ophthalmologist. Had I been a gynecologist, I don't know what they would have presented me. Thank you, ladies and gentlemen. Have a good evening and greetings from Kenya. Thank you very much.